Hi, YouTube. Welcome back to my channel. My name is Dr. Daniel Kaplan, and my mission is to make psychology accessible to all. I am going through a series of 30 videos in 30 days to see if I can share information in a meaningful way to you. And in today's video, we're going to talk about uh, depersonalization and derealization in the DSM-5. So this is the last of the dissociative disorders that we're going to talk about. If you recall, I have a video on dissociative amnesia. I have a video on dissociative identity disorders or multiple personality disorders. And now we're going to talk about depersonalization, derealization. And as always, after I go through the criteria of depersonalization, derealization, then I'm going to review a screening instrument that's quite useful to detect depersonalization, derealization. So without further ado, here we go. So in the DSM-5, it categorizes depersonalization, derealization disorder as a dissociative disorder, even though it's not characterized by memory difficulties found in the other dissociative disorders. So what's important is that this depersonalization, derealization, we need to know what the terms mean. So depersonalization is the sense that one's mental functioning or body are unreal or detached. And derealization is the sense that one's surroundings are unreal or detached. So depersonalization has to do with the individual and their functioning. Derealization has to do with the general surrounding environment. So in the DSM-5, here's the criteria a person must have in order to meet the diagnosis. So there must have the presence or persistence, recurrent experience of depersonalization, derealization, or both. Now, we defined depersonalization, derealization, but this is the direct quote from the DSM-5. So depersonalization is experiences of unreality, detachment, or being an outside observer with respect to one's thoughts, feelings, sensations, bodies, or actions. So there might be perceptual disturbances, there might be distortions in time, there might be physical numbness, and so forth. Whereas derealization is the experience of unreality or detachment with respect to one's surroundings. So people or objects are experiences unreal, dreamlike, foggy, lifeless, etc. Now, during the depersonalization, derealization experiences, reality testing must be intact. So if the person has a break from reality, we might have to consider another psychological condition. Now, the symptoms of depersonalization, derealization must cause some form of distress, whether it be in social function, occupational function, or any other aspect of one's life. And in order to make sure it's depersonalization, derealization disorder and not something else, we have to rule out the effects of substances of abuse, medication, or any other mental condition that is linked to depersonalization, derealization. So if it's better explained by schizophrenia or panic disorder or depression or traumatic disorders or another dissociative disorder, that would not be the case. We wouldn't give this diagnosis. We would probably give one of the other diagnoses that I mentioned at the bottom of the slides. So people with this disorder feel as though they're having, as if their body has become separated or they're separated from their body, better yet, and they're just observing themselves from the outside. And this sense of unreality has the capacity to impact other sensory or perceptual experiences or behavior. Depersonalization experiences by themselves do not necessarily mean the individual has a depersonalization disorder. In fact, transient depersonalization reactions are pretty common. And whereas the symptoms of a depersonalization disorder is more pervasive and more persistent and recurrent. And as a function of that, it causes the distress and interferes with the social functioning that we talked about on the previous slide. So when we look at this condition, it occurs most frequently in adolescents and young adults, but rarely in people over 40. So if we're looking at when the onset is, it's rarely going to just magically appear in middle adulthood. Now, if it appears, it can stay across the lifespan as well. So it does come on suddenly and unexpected, and it is a chronic condition, so it is long lasting. And if you're going to say, well, what causes it? We don't have a good answer. There have been very few good theories that explain the disorder. And ultimately, there's been limited research to try and address this problem. So that is depersonalization and derealization disorder. But before we finish the video, I like to also offer a clinical instrument that we use in our practice to screen a condition like depersonalization-derealization disorder. So let me bring that forward for you. And after that, I think you'll have everything you need to know. So this particular instrument comes from Marlene Steinberg. It's called the Steinberg Depersonalization Test, and it is a quick screen to try and see if a person has had issues related to depersonalization or derealization. So let's go through some of the items. One, I've gone through the motions of living while the real me was far away and it was happening to me. So almost being a passive entity in one's environment. I felt that I was living in a dream. So that's more of a derealization. I've had the ability to see myself from a distance as if I was outside of my body watching a movie of myself. I feel that I can turn off or detach from my emotions. My behavior was out of control. I purposely hurt or cut myself so that I could feel pain, or that I know that I'm real. I've gone through the motions of working while I feel like my mind was somewhere else. I feel as though I'm spacey, and many others, right? So ultimately, you get a sense of what this instrument is trying to do. It's trying to detect both depersonalization, derealization. Now I'm going to go back to the, if you see my cursor, the response options, never, once or twice, sometimes, many times, almost all the time, or only with drugs or alcohol. Remember what we said about drugs and alcohol. They can induce dissociative experiences, and that's not what we're trying to screen here. We're trying to screen depersonalization, derealization by itself. So that's the instrument. It's highly effective at detecting depersonalization. There's a book I think Steinberg wrote called Stranger in the Mirror. If you want to know more about depersonalization or derealization, I highly recommend it. So that's the video on depersonalization, derealization disorder. If you appreciate the content, hit the like button, subscribe, hit the notifications tab, and that will allow me to bring this video to a greater audience and be able to accomplish my mission of making psychology accessible to all. Take care, everybody.